everyone, and I, Dr. Nikita, welcome you in my Pharma online lecture series. We are going to see the solid dosage form and what are the different unit dosage form included into the solid dosage forms. So, let's have a look what are the advantages and disadvantages of the solid dosage form. So these are some advantages and disadvantages, and in other lecture I have covered in detail, which you can go through. Link I have posted into the description. Solid dosage form, which are the various routes you can prefer. So solid dosage form, various routes you can use. Some small inserts or some mini tablets are inserted into the ocular cavity, so ocular route is also used. Some powders are inhaled via nasal cavity, so nasal route is included. Or various tablets, capsules, lozenges, pastil, pills are given via oral route, so it is a most common route. Sublingual tablets are there, buccal tablets are there, so this buccal route and sublingual route is also included. Then some tablets are implant tablets, so they are placed below the skin layer, so subcutaneous route is also used. Some tablets are inserted into the vaginal cavity, vaginal route is used. Some tablet powders are inserted into the rectal cavity, so rectal route is also used. Some powders are reconstitution powders, so they are dissolved and then they are given. So sometimes the oral solution is prepared, so you can use orally, and sometimes the injectable solution is prepared for from this reconstitution powder and it is given intravenously or they are injected. So IV route or injectable routes are also preferred for also used for this solid dosage form formulations. Labeling, packaging, and storage depend upon the stability parameter of the drug. So you have to, if the drug is temperature sensitive, you have to store at particular temperature. If it is light sensitive, you have to store in amber color bottle. Then packaging, various packages you can use strip package, blister package for unit dosage form. Bulk containers like jar, plastic jars, or the glass bottles also can be used for the storage of the solid dosage forms. Then sachets also used for storing some amount of the powder. Various labeling directions are included. If it is unit dosage form, what is the drug content in that unit dosage form? You have to mention storage condition. You have to mention the frequency of dose. You can mention how to take that drug. If it's a reconstitution powder, what are the directions to follow to make solution and to take that formulation. If it is effervescent granules or effervescent tablets, whether to dissolve in a solution or a water and then you have to take. So based upon which formulation you have used and how to take that formulation, you have to write the labeling directions. So next you have, we will see the various dosage forms which are included into the solid unit dosage form. So first you have tablet triturates. Tablet triturates are also called as the molded tablets and they are prepared by molding method. Okay, so tablet triturates are the small cylindrical molded or compressed tablets containing potent drug which is produced by tablet molding process. So you can see in this diagram you have tablet triturate mold, and in this tablet triturate mold you have two plates, one is with cavity and one is with the pegs. Drug is mixed with the diluent and most probably alcohol is used as an binder, because here the compression force is not used and the tablet needs to dry faster, so alcohol is used as an binder. The wet mass with the drug and binder and alcohol is prepared and it is filled into these small cavities of this plate and it is pressed over this plate which is containing the pegs. Once you press it, the mass which is there into the cavity is moved upward and you get the tablet triturates. So you can see some tablet triturates are collected which are from this mold. So once you have prepared the tablet triturate, you have to dry it. As alcohol is the binder used, the drying is faster. You can do air drying or oven drying also can be done. Then they are stored into plastic jar or the glass container. Sometime the tablet triturates are filled into the capsule. Labels you have to mention the drug content into the each tablet triturate, then storage conditions for that tablet triturate. Various examples for this is nitroglycerin tablet triturates, diazepam tablet triturates you can prepare in lab. So that is the molded tablet or the tablet triturate. You have is the tablet dosage form. Tablet is the most common solid unit dosage form and they are prepared from the dry powders or the granules. So tablet may contain one or more active ingredients and they are prepared by compression method. So what are the excipients which are included into the tablet formulation? You have the drug, then you have the diluent or filler, you have binder, glidant, lubricant, sometimes flavoring agent. So you have either dry granulation or wet granulation process. If the drug is sensitive to aqueous binder, then dry compression or dry granulation method is used. So it is also called as a slugging, and the tablets of that powder is pressed, which is having low hardness, and then they are crushed and the granules are obtained, and then these granules are again pressed to get the final tablets. In case of wet granulation, the wet mass is prepared with the help of binder. It can be an aqueous binder, it can be an alcoholic binder, and once the wet mass is formed, it is passed through the required sieve number to get that particular size granules. Then they are dried into the oven. Once they are dry, again passed to the sieve to get the desired size granules, and they are mixed with the glidant, lubricant, flavoring agent, and they are finally compressed to get the required tablets. So that is the granulation and compression method which is used to preparation of the tablets. Now there are various different types of the tablet which you can see. So what are the different tablet? First you have is the compressed tablet. Okay, so in this diagram you can see the various compressed tablets. So these compressed tablets are prepared by the compression of the granules or the powders, and they can be of various size, maybe circular, maybe triangular, rectangular shape size, and they vary in their uh, capacity. Next, you have the orodispersible tablet. The orodispersible tablets are orally administered and they are dispersed into the oral cavity. Next, you have the film coated tablets. These are also the compressed tablet where the coating is applied. If your drug is sensitive for the moisture, to protect from the environmental moisture, a thin layer of polymer coating is applied onto the tablet. Next, you have enteric coating tablet. Sometimes your drug is unstable into the stomach and it may undergo degradation via enzymes of the stomach. So to prevent the degradation of drug from the stomach enzymes, the coating is enteric coating is applied and the tablets are called as the enteric coated tablet. And they also appear same as the compressed tablet with the thin layer of coating on it to prevent the degradation. Next, you have the sugar-coated tablet. Now, generally, sugar-coated tablet are round in size. They are used to increase the palatability and to also increase the stability to prevent degradation from the environmental factor. Next you have the buccal tablet. You can see in this picture a tablet is placed between the gum and the cheek cavity. So buccal root is used and from the buccal mucosa the drug content of the tablet is absorbed directly into the systemic circulation. Next you have is the sublingual tablet. So as the name indicates sublingual, you have to place below your tongue and from the sublingual mucosa, the drug of your tablet is getting absorbed into your systemic circulation. Next you have is the chewable tablet, and these are the chewable tablet. They are similar to compressed tablet, but they are harder because they have to withstand the chewing action or the chewing force which is exerted into the mouth cavity. And they are more palatable. They have sweetening agent, flavoring agent. They are more colored to increase the acceptance of the formulation by the patient. So various vitamins tablets, iron tablets are formulated as the chewable tablets. Next you have is the effervescent tablets. So effervescent tablets are made up of mixture of acids and the carbonates. So when you are adding into the water, they dissolve and they give out the gas carbon dioxide, and then you have to take the formulation. Next you have is the dental cone. So dental cone, these are inserted into the cavity where the tooth is extracted. They undergo subsequent erosion by the action of mouth saliva and water, and they help in prevention of multiplication of microorganism at that particular area where the tooth is extracted. Next you have is the floating tablet, and you can have a look of this floating tablet. When you want the localized action of the drug into the stomach, then you design it in as a floating tablet. So tablet is retained into the stomach, it doesn't pass or it is not forwarded toward the intestine region, and the drug is released into the stomach region. Then you have the hypodermic tablets. This is the diagram for the hypodermic tablets which are placed below the skin and from where the drug is getting released. Then you have the layered tablet. When you include two or more drugs into the same formulation, and to avoid compatibility, you are formulating in the form of the layered tablet. So this is the picture for the layered tablet. Then you have the vaginal tablets. Vaginal tablets, these are simple compressed tablet which you have to place into the vaginal cavity for treatment or vaginal infection, or you have the localized action at that particular region. So it has an applicator, and with this applicator you have to place the tablet into the vaginal cavity. Packaging tablet, you can have blister pack, then you can have the glass jar where the tablets are stored, or the plastic jar bottles where the tablets are stored. Blister pack is used for the tablets. The labeling, you have to mention tablet as it is a unit dosage form. The drug content into each tablet is mentioned. Which coloring agent, flavoring agent you have used for the formulation. If it is a coated tablet, which type of coating you have applied, that is mentioned onto the label. Storage direction is mentioned, that what should be the temperature, where it should be stored, and the time or the date before which you have to use the prepared formulation, that is also mentioned onto the label. Here I have an para 650 tablet. It is uncoated tablet. The content of the each tablet paracetamol IP 650 milligram and excipients quantity sufficient. Dosage they have mentioned as directed by physician. Storage condition they have mentioned store at temperature not exceeding 30 degrees Celsius and protect from light and the moisture. So this is oval shaped tablet with central break line. Another tablet which I have ferrous ascorbate and folic acid tablet IP. So this is then film coated tablet. They have mentioned composition. Each film coated tablet contains ferrous ascorbate IP equivalent to the elemental iron 100 milligram, folic acid 1.5 milligram, excipients quantity sufficient. Then the color red oxide of iron and titanium dioxide they have mentioned. Dosage they have written as directed by physician. Storage, store in cool dry place, protect from moisture, keep out of reach of children. So this is the elongated shape tablet which is having the print of the name of the tablet. Another tablet I have which is a pantoprazole and domperidone tablet, and this is an enteric coated tablet. This is an enteric coated tablet. So you can see different size and shapes of the tablet. This is plain tablet, film coated tablet, and the enteric coated tablet. Effervescent tablet formulation I am having. It's a plastic container. They have mentioned content of the tablet: vitamin C 1000 milligrams. Directions for use: they have mentioned to dissolve tablet in a glass of water. So let's take out one tablet and let's see how it behaves. So I'm adding in water and you can see the effervescence coming out from the tablet. Effervescent tablet, they are made up of acids, citric acid, tartaric acid, and the bicarbonate. So when you add in water, it dissolves by liberating carbon dioxide. So you can see the tablet size is reduced and it is completely dissolved in water, and now you can take this solution. Now next you have is the capsule. So what are the capsule formulations? These are also the most convenient and common solid unit dosage form. So you have capsules which are of two type. This is the hard gelatin capsule and this is the soft gelatin capsule. So hard gelatin capsule, you have the cap and body, and in that you can fill powder, granules, pellets, tablet, triturates. And these are the soft gelatin capsules which are soft and flexible. You can fill oil, liquid, viscous liquid, semi-solid formulations such as ointment. So how the capsules are prepared? Simple capsule filling machine you can see. You have the plate which is having cavities. So first the whole capsule is filled inside this cavities, and the cap and body of the capsules are separated. Once the cap of the capsules are separated, the powder is getting filled inside the capsule body. Once the complete powder is filled inside the body, the cap plate is placed on it, and the body and cap of the capsules are interlocked with each others and the capsules are separated. So this is the lab scale machine which you can use for filling of the capsule. Now, what are the labeling directions and the container closures? Capsules can be packed into the blister package or into the strip pack. They are also stored into the plastic jar container or the glass jar container. As they are made up of the gelatin is hygroscopic. It absorbs the moisture from surrounding and they become soft. So you have to store into well closed container, and you have to store at cool dry place. So these are the labeling direction. Drug contained into the each capsule you have to mention onto the label, and the date before which you have to use, that also you have to mention onto the label. Question you have isn't this is the Pandy capsule I am having, and it's a hard gelatin capsule. So it's capsule which I have in my hand, and let's open the capsule. This is the body of the capsule and this is the cap of the capsule. In the body the content is filled. You can see some this pellets they have filled. Now, one more capsule I am having. So let's see how are the contents inside this capsule. And it is having some white color pellets they have filled in this capsule shelf. One more capsule I have here and I will open them and let's see what is there inside. So here some powder is filled in the capsule. Okay, so this is powder filled capsule. I have one soft gelatin capsule. Now, so let's see. This is soft and it is flexible. Let's cut it and let's see what it is having. So the tip of the capsule is cut, and we can see this oil is placed in the capsule. So viscous liquid, some semi-solids, gels or ointment also fill into this soft gelatin shell. Now next you have is implant. These are the sterile small tablets meant for the insertion under the skin by making small incision beneath the skin, which is then stitched. So either small surgery is required or some specific devices are required which can help to place the implant below the skin. So in this diagram you can see this is a small implant and this is the device to put the implant below the skin, and you may need small surgery to stitch the area or the skin where you get the cut. So various contraceptives are given in the form of implants. Then testosterone is also given in the form of the implant. So these are some examples where the drug are formulated into the implants and given to the patient to have slow and sustained release of the drug. So the various key points to remember is the definition of that formulation which you have prepared, route through which you are going to administer, various advantages, disadvantages of that formulation, labeling directions, different packaging which you can use, storage condition, and the various examples you can give for that particular dosage form. Enjoy learning and keep growing. Thank you very much.